back, everybody, for this next episode of the Kentucky Pharmacist Podcast. We are joined this episode with two folks from the Sullivan University College of Pharmacy and Health Sciences. So we have on rotation with us at KPHA Dylan Hooper, a third-year student there at Sullivan, and also joined by Dean Misty Stutz. So appreciate you all joining us today, and for all of the listeners, if you don't mind, to maybe give a quick introduction.
I guess I can go first. So, hi everybody, my name is Dylan Hooper. I am actually a third-year student at Sullivan College of Pharmacy and Health Sciences. Currently in rotation with KPHA, coming up on the end of it. I guess I could say, as far as outcomes go, I'm looking more into the community side of it and a little bit of advocacy. That's kind of where I'm looking at. Anything else you want me to add in there?
Where are you from?
I'm actually from Louisville. I grew up in Louisville, moved out to Mount Washington, just outside of there, and then ever since I went to the University of Louisville for my undergraduate. Then went to Sullivan, also in Louisville, for my doctorate.
Nice. Kick it over to Dean Stutz.
Hey everyone, this is Misty Stutz. I am currently the dean at Sullivan University's College of Pharmacy and Health Sciences. So a little bit about me. I am a pharmacist, graduated with a BS in Pharm from the University of Cincinnati, and then went on to my PharmD from the University of Kentucky. Been living in Louisville for 20 plus years, and I've been at Sullivan now for almost 16 years.
Wow. What was your transition to become a dean at the college? What was kind of the steps that you took for that?
Oh, very unexpected. Let me just say that, Ben. So, I had 20 plus years of community practice. So I started practicing when I lived in Cincinnati. And then when, we transferred down to Louisville, moved to this district. And then when Sullivan opened in 2008, I actually came on the experiential education side. So I was the director of experiential education, got the clinical sites ready for our first class. We had 74 in that first class, and it was my job to make sure that all of them had a practice site. So started there, did that position for about 5-6 years, then became a department chair, pharmacy practice. Did that for about 5 years, and then now I've been dean for almost 6 years.
Pretty an interesting background. You never know where the pharmacy world is going to take you. Was this on your bucket list?
Oh no, are you kidding me? I never in a million years would have thought I'd been in this position. I mean, but you're absolutely right. You have no idea where your profession's going to take you. And that's the beauty of being a pharmacist. I mean, you've got this skill set that lets you practice in all kinds of different areas. So yes, I think I've been blessed to be able to have a lot of different experiences.
For sure. Well, Dylan, one of the parts of our rotation that makes it so unique is just that. Like they're all different. Everybody that comes through, every rotation is a little bit different. But one of the cool things I think is getting to sit down and have conversations with your dean, or maybe it's a legislator or a policymaker, somebody at the board of pharmacy. So this is your time to kind of ask questions of both the dean and I, and we're going to kind of stay focused on pharmacy education, kind of where we are now, and maybe some future trends. But any questions that you want to start off with?
I guess the first one that I can start off with, just because I know from me coming into pharmacy school and then the current, say, I believe P1s, the first years, things like that, the curriculum has changed, the format has changed, things like that. So kind of how do you see nationally, like the pharmacy education changing? Like that could be like curriculum, technology. So, and then kind of how's that being implemented at Sullivan? Because I know things are changing, but I'm kind of in front of the scenes, you're behind the scenes, so it's kind of hard to see.
Yeah. So, pharmacy education has to follow market trends, but they also have to lead the way. So where do we want pharmacy to be, and making sure that our graduates have those skills. And so, yeah, like you mentioned, Pharmacy education is moving more into a hands-on application type environment. So no more just sitting in a class and listening to a lecture and taking notes. I mean, those days are becoming less and less. And a lot of that has to do with the skills needed in today's workforce. So pharmacists have to be really strong critical thinkers. And so one of the things that we've done is we've put together a curriculum that allows our students to learn the basic knowledge, but then start applying it, but either through simulation on our patient care labs or through our clinical problem solving course or experientially. So we actually moved to a longitudinal introductory pharmacy experiences. So community throughout the P1 year and institutional throughout the P2 year, and then of course APPEs in the 3rd year. So students are definitely not just sitting idle in the classroom.
Gotcha. Yeah, I can definitely attest to that one. I think the experiential education aspects are very beneficial because me coming from a background of kind of dabbling in pharmacy, but not having the years and years of experience that some people have when they come in, actually getting to do it through my introductory pharmacy experiences and then now my advanced pharmacy experiences has definitely kind of shaped where I want to go and what I want to be and kind of just seeing it all at that point.
To kind
Go
of
ahead.
look, while we're on the topic of trends in pharmacy education, Dean, I know you stay very in the know on, you know, trends as far as enrollment and people applying for pharmacy school, graduation rates and whatnot. I think the last time we talked was probably around this time last year. Have we seen any significant changes in the landscape of schools? I know we're not seeing any more openings. That's kind of stalled, but are
Yeah.
any closures or any trends that you've seen, positive, negative, or otherwise in enrollment?
So yeah, Ben, you and I have had some pretty long discussions about the decrease in students. Started back in 2017 nationally, and we've seen it here at Sullivan for sure. Those trends are leveling out, and Farmcast, who is the application service that we use, has shown some slight uptick in the number of applicants, but not significant, not at least in the Midwest region where we're at. Because of that, we have had 2 schools nationally that have closed, and I wouldn't be surprised if maybe we see a couple more of those. But yet, in the same token, our undergraduate pipelines are showing an uptick in the number of students that have put pre-pharmacy as their major. So we know that those trends are starting to reverse. We clearly know that there's a job shortage. We have employers knocking at the door trying to get in front of the students because they really need those employees upon graduation. So we know that it's going to improve, but right now enrollment is pretty much stagnant from what it was the past year or so.
Okay, thanks for the update. Dylan, any other kind of big picture questions or thoughts?
Um, Kind of in the same realm of like how the curriculum is changing and the landscape is moving in different directions. I know in Kentucky, with the push towards like provider status, prescriptive authority, the implementation of board authorized protocols, things like that, those may not be a standard curriculum change because it's kind of state by state, but how has Sullivan kind of adapting to these changes and kind of implementing them into the curriculum?
That's a really good question, Dylan, because states are very different, and yet we're graduating a student that could pretty much practice anywhere, and that's the whole goal. Although the majority of our students are from Kentucky and Southern Indiana, we do have some students from out of state or that intend to go to another state to practice. And I think the answer to your question is we are emphasizing that the patient care piece, like having a pharmacist be an independent provider of care for patients. And then, like, we definitely, I don't know if you were aware, but ACPE, who is our accrediting agency, has implemented a new set of standards that start in July of 2025. And one of the things that they added was diagnosis. So we have to teach diagnosis and prescribing in the curriculum. We were already doing that, but now all schools throughout the nation will be teaching those two components. We also touch on medical billing as a component, not in depth, but we definitely talk about the differences between billing for drug product as opposed to billing for patient care services. So, I think we've been educating students for these advanced roles, but we're adding some other pieces to it to make sure that they're immediately ready for practice.
Gotcha. Yeah,
And
I know.
I do think
Sorry.
that Sullivan's uniquely kind of positioned for that, where you have, the PA students there on, within the college as well. So, I think that Sullivan will have an advantage there over, other colleges that are similarly situated. Um, it's interesting that you talked about medical billing. People, we hear that sometimes like, well, I don't, I've never learned how to medical bill. And I say, well, I don't know, when I was in pharmacy school, we never processed claims in the lab. Like you
No,
learn that on, either on the job or you just don't do it. But processing rejections and whatnot for, like, you don't teach that stuff in pharmacy school. You just learn it, and maybe you do through your experiential education. But, um, at the end of the day, most providers aren't doing medical billing. They have a team that's doing that for them, right? So,
yes,
uh,
I would agree. Even in our PA education, we touch on it, but we don't go into depth because in the real world, the provider is not necessarily doing the billing themselves. They're just putting in the correct codes and descriptions to make sure that it gets billed correctly. So,
yeah, understood. Sorry, Dylan, I cut you off.
Oh no, you're fine. No, and so I'm actually going to go in a different direction because you kind of brought it up. So Sullivan does have the PA program, which, speaking from experience, it actually kind of, you do get a leg up, in my opinion, from the pharmacy side, because there are certain events that they will host for the students. They're called IPEs, interprofessional events, and it is literally the pharmacy students and the PA students, and you're put on a case, and you kind of get to see the other side of the coin. You kind of see how the PAs are going to run things. They see how you run things, and it kind of teaches us how when we get into the real world, we're gonna work together, and kind of how that goes. Now, medical billing, like you said, that's like a whole different beast and a whole different thing. But in terms of kind of working together, curriculum, being prescribers, working in that aspect, you definitely get a much better kind of perspective on it by going through it.
so let me ask you, Dylan, do you think it changed your perspective as you moved into API? I mean, what benefit do you think it had for you to have worked with a prescriber during your didactic years so that when you got out on API, did it make
Mhm.
any difference to you?
I think it did because when we were going through the IPE events, what you kind of see is that, oh, well, we were taught kind of diagnosis, but it's diagnosis in like a big picture, and like certain small technicalities we would never pick up on, we'd never catch. So when you kind of look at a big picture and you're stumped, you kind of go what to do in when it's just you and another pharmacist. But when you have, say, a resident or another physician or something like that with you, you can kind of ask questions, kind of delve deeper, and they can kind of give that insight that you wouldn't know otherwise. But if we had had the IPE events, you may not think, oh, that's the avenue I need to go in the situation.
Pretty awesome. Um, Dylan, I don't know. I think hopefully we can talk a little bit about, what the dean thinks the future of pharmacy looks like, and as
Mhm.
KPHA, as the advocating arm of the profession. Excuse me, there. What we need to be kind of planning ahead for in future years to prepare, pharmacists to, do we need what laws, rules, regulations do we need to be focused on changing so that all these great things that our colleagues are learning are able to be put into practice in the real world.
So I'm going to use a little bit of an example from my pharmacy education. Obviously, I'm closer to the end of my career than the beginning of my career. And we spent a lot of time thinking about the properties of drugs and the distribution of drugs and education. And we spend very little time on that currently. So we're more about educating the pharmacist on how to take care of the individual patient through the use of medication, both in the prevention of disease as well as the treatment and control of disease. And so, when a lot of the regulations and some of the barriers that we have currently are based on that distribution model that we had 30 or 40 years ago. And so when I'm thinking of pharmacy of tomorrow, there's really not going to be very many drugs in a pharmacy. Most of those drugs are going to be filled elsewhere. They're not necessarily filled by the pharmacist there that's in the community setting. And so I think, what this professional organization can do is continue to move the payment model forward for pharmacists to be able to have a reimbursement model that allows them to be the medication expert without having it tied to a product. So, I mean, this organization, KPHA, has done a fantastic job of continuing to do that, both with PBM reform and then, payment parity and all that kind of good stuff, which is really, I think, what's going to continue to need to happen for us to move the needle forward.
Dylan's going to get a big dose of that over the next couple of days. We're getting ready to go to the NCPA fly-in, so getting to see kind of how we engage with our federal delegation, and one of the talking points will be the ECAPS legislation, which has really been a focus of APHA, but NCPA, from what I understand, is including that in their talking points this year, to have Medicare Part B recognize pharmacists as billable providers for test and treat, just for flu, strep, COVID, and maybe UTI. I don't know if that one's included in there or not. But again, I mean, I think, we've got commercial payers on board in Kentucky. We're working really hard to get Medicaid next. So we got legislation passed this year to have Medicaid do a study. We know Medicaid's working on that. Hopefully we come back in 2026 and get that passed. So if we can really get all three of those components moving in the same direction, I think, there's two things we got to be concerned about. And one is billing and being able to bill for those services. And then two is, we got to knock down these barriers that are preventing pharmacists from practicing at the best of their ability. And Dylan and I have talked about this a little bit during his time here, but it's not about we're beyond pharmacists practicing at the top of their license. We need pharmacists to be able to practice. At this point, our license is prohibiting people from practicing to the full scope of their ability. And I think at the end of the day, Dean, that hurts, students that are coming in, because they talk to our colleagues and people are frustrated. It's like, well, I learned all this great stuff, but I don't feel respected. I don't feel like I have all this knowledge, but I'm limited on what I can do with it. And that's where I think if we break through those barriers over the next 5 to 10 years, that we will see more people choose pharmacy as a profession, because so much of medicine today is really just medication therapy management. I mean, it really is. If you think about how much time is spent with the primary care, just reviewing medications alone and trying to optimize those, and there's no better person to do that than a pharmacist. But today, most patients don't have access to that level of care from a pharmacist unless it's in a really niche type setting. And we have a few of those across the state, but we need that model to be available to every patient in Kentucky, in my opinion.
Totally agree with you. I think pharmacists would have a much greater job satisfaction rate if they were able to actually do the things that they were trained to do. And that will only happen if they can financially be rewarded for those things. So totally agree with you.
Yeah. Dylan, what other pressing questions do you have for the podcast today?
So it kind of leans into what we just talked about, and this is a good talking point for both Dean Stutz and yourself. from the KPHA side. So for say returning listeners or new listeners of all backgrounds, 20 years in, still in pharmacy school, where should they, like if someone wants to be an advocate and practice advocacy, where should they start? Like
Well, I can,
what do they do first? Where do they go? Who do they call? Who do they talk to? Who do they contact? That kind of stuff.
Dylan, are you
yeah,
talking about professional advocacy, like for the profession?
Yes, yeah, because we're talking
Okay.
about kind of like wanting to practice, kind of we're being limited down in our license and things like that. So where can people start to try to kind of remedy those situations?
well, I want to start by giving a lot of credit to Dean Stutz at Sullivan specifically, and no shade thrown on the other college because we certainly get a lot of support from them as well. But and everybody's approach is different, and I get that. But I think Sullivan really focuses on advocacy, um, and Dean, you do that in a very hands-on way with making sure that you come along with students to Day at the Capitol or our fall conference. Um, and I think that work and that you highlighting that will make better advocates in the future. That's where they learn, just like they learn, the curriculum in the classroom. You at least know how to be a better advocate. And I think it just starts with building relationships, Dylan. I mean, everybody needs to have, know who their legislators are, know know who the folks that serve on our board of pharmacy, build a relationship with them. Um, and it's not about every phone call being a problem that you need to solve or a fire that you need to put out, but just really getting to know them in your communities, um, and supporting them along the way if you can. If you feel like they're a good candidate, then supporting them in however way you feel best. But it really starts there, and then at that point you build that relationship, and maybe you bring a legislator or a policymaker into your pharmacy. Say, hey, here are the problems that I'm experiencing, and I think out of the greatest change I've seen in the pharmacy uh, landscape, or especially when we're talking about changing laws and regulations, it always starts with that encounter for some reason because they can see firsthand what people are experiencing. Is it a DIR fee? Look, these are my numbers. This is how much is coming back out. This is how the process works. Those types of encounters, I think, really start to drive that change. But you have to be comfortable having those conversations, and you can certainly do that without being political. I mean, it doesn't matter. Healthcare is bipartisan or nonpartisan, and our we need to treat it as such. So I don't know, Dean, anything that you want to add to that?
I would actually, I mean, you're absolutely right. But for those folks that don't feel really comfortable reaching out to a legislator, I think the very first step is to join a professional organization. And KPHA is the organization in the state that really represents pharmacy and stands up for the practice of pharmacy. So I would highly encourage anyone, student, pharmacist, you name it, put that small amount of money toward a membership because this organization is fighting for our profession. So, and I really appreciate that we have a voice because I mean, we'll remind the students the Board of Pharmacy is there to protect the public, but actually it's KPHA is there to protect the profession, us.
Absolutely. Yeah. Well, well said there. And I mean, I have to tell people from time to time, on any given day in Frankfurt, there are two pharmacists roaming the hallways of the Capitol or the Annex, and they both work for KPHA. There are a lot of other folks that are advocating on our behalf, and they do a great job. Uh, but they're not us, right? So it's important, and I think our board feels that it's important to maintain having people within the profession represent the profession. Um, and it's an honor to do so. But I think that's you get pharmacists go to work every day, right? They got families, they got their career in front of them. the very least you can do is join the association to support the work that we're doing. And I certainly appreciate the kind words there, Dean. Dylan, how about any follow-up or wrap-up questions as we get towards the end of the podcast?
I think that was my really big end one, because I know we're getting close on time here. Anything you want to add on there?
No, I just again want to thank both of you all for joining us this week, and Dylan, I appreciate you choosing the rotation. I don't think we got to talk enough really about your experience here, but maybe in 30 seconds or so, just kind of give folks a highlight of what the rotation's been like for you and what you hope to accomplish in your next couple of weeks as you wrap up here.
All right, speed round. I would say with KPHA, you get a lot of things that you don't see other places. So I've had rotations at hospitals. I've been in a specialty pharmacy, independent pharmacy, all these kind of things. But with here, I've gotten to do so much in just 3 weeks. For example, this week we're going to DC. We're doing a fly-in. We're just going to go talk to House of Representatives, senators, things like that. I've gotten to work on creating CE. So CE that's going to be available to the state, going through the editing process, looking at the regulations on what it has to require, things like that, things you don't normally get to see. I've gotten to work on, for example, our spring annual meeting, get to work on things for that. It's just all these different aspects of pharmacy that you don't get to see in a normal rotation, you get to do here. And it's cool things that are actually, it's been not just benefiting, say, like the hospital, your rotation, it's benefiting kind of the state. It's anyone who has a membership at this point. So it's a really cool side to see. If you're wanting to do advocacy, wanting to see the legislative side, 10 out of 10 would recommend. I mean, Ben and I got to go sit in with the Department of Agriculture on some stuff, talk with their representatives. You know, it's a very interesting, very fun way to do it. So
a lot of behind the scenes parts of government that we as a profession have no clue those meetings happen, but we absolutely need representation there. So I'm glad you've got to experience that. And like you said, every single rotation is completely different, just depending on what's going on at the time. So I'm glad you've enjoyed it. Dean Stutz, will kick it over to you for final remarks and wrap up.
Well, Ben, I just want to thank you for allowing me to come on this podcast today and share my thoughts about the future of the profession. And I thank KPHA for all the work that you do for not just the colleges, but for the profession. So thank you so much.
Absolutely. And thank you for your time. I know you're a very busy woman, and always good to catch up with you, and appreciate your insights on what's going on in the greater pharmacy education community. So with that, we'll wrap up. Just encourage folks to like and subscribe our podcast, and we'll wrap it up for this edition of the Kentucky Pharmacist Podcast, and look forward to joining everyone again. Y'all have a good day.